Our next speaker will be speaking on fall prevention, Jennifer Keller.
Hi. Thanks for having me back again today. You guys asked me to talk about fall prevention, and I guess I haven't actually done that before, so I appreciate that because I think it's a really important topic. And I'm gonna just kind of give you what I found is available in the literature about fall prevention, and then kind of like my own, what I would think is important. But to be honest, we don't really know the best way to prevent falls in ALD and AMN. So I think it's a little bit of a individualized basis at the moment. But I thought I would talk a little bit about defining a fall. Maybe that seems obvious, but then the consequences of the fall, which, are not the best, but can have a positive light as well. And then identify some of the causes of falling. And most importantly, talk about ways that you can prevent or find strategies to prevent falls. So first of all, a fall is any unexpected event that results in you ending up on a ground or floor or any lower surface than where you are. And this is like a technical definition, but an important other aspect that we often ask about are near falls, which is losing your balance but managing to stay upright. For example, like holding on to something. And so I think I've heard in the last 2 days, a lot of people fall. And I was really glad actually to hear a lot of people say, you don't really want to, and you might want to think about it, because I think we often begin to think that if we have some abnormality with our walking, that's just it's just going to happen, and we're just going to have to deal with that. And maybe we're a little bit riskier than we should be. I heard about your rib fracture. In fact, my husband had a fainting episode and broke 2 ribs recently, and we learned the impact of a fall that can occur quickly, and it can really change your life. And so I think we could see it as a wake-up call. In fact, I was at a meditation retreat recently, and this is what they said, and I thought, well, it's really appropriate. So there's really nothing like ending up on the floor to bring you into the present moment. I don't know if any of you have ended up on the floor, but the only thing you can think about is, how did I get here? And usually you have no idea. And then how are you going to get out of this predicament? And so you might just see the sky or the grass, and there you are. And it might be a sign that you have become too comfortable with your desired activity level. I think you've heard a lot about exercise, and I'm as guilty as everyone of not exercising despite knowing the benefits. And I think you begin to think, especially over this pandemic, that less and less activity might be normal, and you begin to forget what is an actual, might be your expected level or your preferred or what you kind of hope would be your activity. And then I also think that, feeling off balance is a way for growth. And maybe that I've done an exercise study, which I'll talk to you a little bit about balance training. And one of the main outcomes from that was that you really have to challenge your balance in order to improve it. So I think if you're off balance, one of the things you might need to do is find that happy medium where you're just a little out of your comfort zone and you're practicing getting back on balance. So I think I mentioned some of the consequences of falling. It's obviously injury. I did hear someone say it might take a lot more effort to recover when you have something else, and I do think that's an important thing to think about. It's still possible to recover, but it might take longer and it might be slower. And if you're not as fit as you can be when you fall, you may have that in addition as to kind of just that atrophy that we get from not being active. But there's financial costs. And then I think really importantly to the topic of this meeting, it can reduce your quality of life, because one of the main risk factors of having a fall in elderly, but in other populations, is just having a fear that you're going to fall. So think about walking out of your house when it's snowing and there's ice on the ground, and you're nervous that the ground under you is unsteady. That is actually a risk factor for falling. So if you get to begin to feel like you're at risk of falling, that alone can increase it. And then, as we've said, it can decrease your feeling of independence, and it can make you stop doing things that you enjoy and not participating in life like you would like. So it has really important consequences. And let's see. So, what are causes of falls? So, I think their typical impairments are, balance issues, having weak muscles. So you really need your muscles, one, to hold you in a good alignment to start, and then to help you recover when you have a loss of balance. Sensory changes. So we really use our sense of where we are in space at our ankles primarily, but then further up as we're keeping our balance from our hips. And then we also really rely on our vision. I don't have here as well, but our inner ear vestibular system is important. And so in particular in ALD, if you have sensory changes, the brain is really great because it takes these three systems and it says, okay, I can't rely on my sensation. I'm going to upregulate how much I rely on my vision. And so that goes along with someone who said dark is our enemy. You really want to have the lights on because you're really using your vision to help you with your balance. So other things that are important in falling is the environment. So wet floors, tripping hazards. If it takes you, I feel like at work we constantly have things about making sure you don't have wires and desk drawers open and all those things. They're just as important all the time to make sure you don't fall. But then having other health conditions. So you could have a problem with your low blood pressure that makes you pass out. If your cognition is impaired, you maybe do things too quickly or you get distracted, and those things can also lead to falls. So it's important to realize that it may not be just your ALD or AMN symptoms that could cause you to fall. There can be other things as well that you might be able to change with good attention, and there might be other things that are difficult to prevent, just like aging. So I thought these were two. This is one interesting thing I found in my searching about falls. One is that 50% of people with multiple sclerosis are fallers, and I'm pretty sure we would find something similar in the group today. But also what was interesting is that there are a number of different risk factors that I think would be anticipated, like the longer you've had the disease, that makes sense. The more, severe your symptoms are, if you're older, if one of your symptoms is having poor balance, if you walk slowly. I thought that the use of a mobility aid as a reason for fall seemed strange to me because I think that I would recommend that you use a mobility aid. And what I found was that they don't really know why that is. And a lot of what they actually think is some of it is education, that people just choose their own mobility aid without getting any assistance or education in how to use it best and what might be the most appropriate one. And so that might be one issue. Or it could just be an indication that, you're just more impaired, and so then you have more risk of falls. And then, as I sort of mentioned, but cognition, so your attention to your environment and what you're doing can also play a role in falls. Additionally, there was a recent study published that looked at 300 people with neurological disorders and what were the risk factors for falling. And 40% of those people were fallers. And not only that, but 20% of that 40% had a significant injury. But what they found was, which is very common, is that having a history of a fall is the main indicator of falling again. And that's when I kind of go back to the wake-up call. So when you have one fall, I think it's the time that you need to take it into consideration and figure out what's going on, at least start thinking about it, make it your thing that, identifies that this, maybe this wasn't just a fluke and I need to pay attention to what's going on and see if there's something I can do about it to prevent another one. Another thing that they found is that variability of certain features of their gait impacted whether or not you're likely to fall. And as a physical therapist, I would say that, if using a walking aid would make you less variable, and then that potentially could be something that would make, you less likely to fall as well. So I think that's just something to consider. My research brain says, well, we really don't know what the risk factors are in AMN. And there's a lot of us who in research that are interested in this now and are starting to ask it more reliably and with more information. But I think you can help yourself out and us by, keeping a record of your falls. Things such as, whether or not you've fallen before, or whether or not you're afraid of falling, then thinking about how long you've had symptoms and what your symptoms are. I put this picture up because a gentleman with AMN very early in my career gave me this T-shirt, and so I still have it, and he would wear it to the gym as his like marker that like it's supposed to having an aid and getting people to notice that he's walking around. This was his indication that like if I end up on the floor, it's all right. I was kind of expecting it, but. I haven't seen them make it on market and all, but maybe they should come back. I think I started a little earlier, but so keeping a journal, summarizing your falls can be really helpful to us as clinicians and to yourself. And like we would like to know how often it happens and what situations it happens in, and whether or not you have injuries, and that can help us target your intervention. I talked about accelerometry yesterday, and there's a really interesting study that talked about looking at fallers and non-fallers, and activity was one of the things they actually had to check out was like when did the falls happen. So people who fell like hiking, they didn't have as many complications. There was no reason to address that, as opposed to people who fell in their bathroom or doing their everyday activities. I mean, I think that's obvious, but we could see that in their activity. And so I think that those are things to think about, like when did it happen and whether or not you take action. The main things about fall prevention that I can find in the literature that tell you what will improve it, the first one thing is actually education. So it's great that you have this to refer to and some other things, but there's a lot out there. So definitely, get educated on fall prevention. Another thing is exercise, and it has to involve balance. So there's a lot of things out there about you can do strength and balance. You can do my favorite, which is Tai Chi, but there should be a balance component. And I feel like I've often spoken to this community about strength training, and I haven't talked a lot about balance. And I would say, listening to what everybody's exercises are, I don't really know that I've heard that anybody actually focuses, or a lot of people focus on balance in particular. So I think that might be something we should talk about moving forward. Adaptive equipment like walkings and canes, orthotics and braces, which can help with foot drop or weakness, and then modifying your environment is another thing. But then also planning and awareness, knowing where you're going to be, what kinds of things there are, kind of preparing. Maybe you take one of those folding canes with you, so that at the end of the day, when you're tired, you have something that you can rely on when you need it. And then communication, like getting others to help you, like just recognize if you need a hand, or maybe I know a lot of people tell me, first off, that they walk along they walk in a hall and they always walk along by the wall, because you can basically use that as a reference for your vision, and you can use one finger along that to get your sensation from your finger that you're not getting from your feet. So those are kind of like little tricks, but you can kind of ask your friends that you can stand next to the wall, or you can do those things a little bit more ahead. And then I think you should plan how you're going to get up from your fall, because it is hard to get stuck in the middle of a room and not be able to get up, or out in the community. And so thinking about that as well. Towards the future, and if you want to look into more information, the CDC has a lot of recommendations for what makes good fall prevention training programs. So, evidence-based, and making sure that it addresses things that you can actually modify in some way, making sure that you have reference materials, and whether or not the person who's teaching you needs to have some sort of special training in it or not, and then pre and post testing and follow-up. A number of resources are available in the MS world. I'm just more familiar with that, but Can Do MS has some training programs. The National MS Society has a program, Free from Falls, that you can do online. Otago, I don't actually know how you say that, but I think it's from Australia. They have a falls prevention program that's taught by physical therapists. I'm trained in this Tai Chi Prime program that actually makes Tai Chi accessible to all levels, sitting, using a walker, and standing. But they have shown that it did prevented falls in older adults who did it twice a week for 6 weeks. And then the CDC has some more references for you. The balance training, I'm just going to touch on it a little because I think that's the important part. It can happen on a varied support surface. So like the hard floor, you can use foam, you can use like a balance ball, you can use a tilt disc. The study that I did was actually with people with ataxia, and they were all able to walk, but we did half the exercises in sitting as well as standing. Because I think, as someone mentioned, like you need to train your core, your trunk in particular, as well for balance recovery, and you can do that in sitting. So you're not limited to only doing standing balance exercises. And I think, like Dr. Sagowski said, most of my subjects didn't do them all at the end of the day. They kind of spaced them out and did some in the morning and some in the afternoon. So it's not necessarily to get all of your balance training in at one time. And then they involve things like turning your head, then turning your body, maybe reaching for something, and then closing your eyes is obviously going to make things a lot harder, especially when you're relying on your vision a lot more, but those are ways that you would challenge it. And then another main way to do it is to decrease your base of support. So, you think about standing with your feet one foot in front of the other, maybe putting one foot up on a step, trying to maintain yourself, in a stable position. You can do that on different surfaces like foam, and a half roller if you're really good, but you really need to practice and you need to do it safely. So this is a research student, and he's just showing that standing in the corner of a room is a really good way to have like a back support, and you could put a chair in front of you and then you have something that you can hold on to if you need it. That's kind of like the standard typical way you can find a place in your home that you can work on balance if you need to. And then this is an older article, but Sherrington wrote about, what was necessary in balance training in order to prevent falls, and there were three main things. So one was that decreasing your base of support. The other was some sort of training that teaches you to keep your center of mass, which is, theoretically located around like your low back, just behind you, and then over your base of support. So that's wherever your feet are. You want to be able to stay over that. If you go over it, you're just going to tilt over. So it's moving, but making sure that you learn how to move and keep yourself stable. And then the last thing was to decrease the amount of reliance on upper extremity support. And that's not to throw away your walker, but maybe to practice things where first you're using both hands to keep your support, and then you're just decreasing how much of that support you're using. So maybe just light touch of your fingers, maybe just one hand when you're trying to stand on one foot, something like that as a way to challenge your balance, but not to just get rid of them altogether. And it was, in our study, in any case, a really small amount of exercise, actual time that was important, like 20 minutes a day for 4 days a week for 6 weeks. But the key was the people that really found it challenging, so more than 50% of a challenge. So if when you stand on one leg, you have to, like, over the course of a minute, occasionally touch the floor with your other foot or hold on to the thing just lightly, that's when people got better, that they were challenging you have to sort of like perturb your nervous system to say, oh, something's wrong. I need to do something to make it better so that it can learn. As opposed to, like, I had a couple of subjects say, oh, I can do all the exercises you gave me, Jen. I just hold on here and pick up my foot and I've got it. And I was like, oh, I did a really bad job of training. So, but it's easy to kind of take something and run with it and not always do it, accurately. So I just think that it's important to kind of have someone maybe help you find that perfect bit of challenge. And then as you get better, keep challenging yourself. And then as you maybe progress, like re-modify those so that you're always still at that challenge level. And I think the important part about having sitting and standing balance exercises was that, like, at the end of the day when you're tired, you could do the sitting balance ones probably better. And then at the earlier part of the day when you have more energy, you could work on the standing ones, because we sort of have a range of what our ability is, depending on the circumstances. So I still didn't leave strength training out. I think isolated muscle strengthening is really important, especially for balance. That would be like in an AMN in particular, your hip strength is really important. If you've lost, ankle strength, then you're going to just be more reliant on it. But also being able to strengthen your muscles and maintain your posture correctly is really important. And so I think you need accurate exercises. And then again, it's challenge. So you need to be challenged by it. Like, you need to feel like you're working at 50%, 60% of your effort. Like, it's hard work. And over the course of 12 weeks where we did this with people with MS and healthy controls, like people said, well, I thought it was going to get easier, but it doesn't get easier. This is like strength training, right? At the gym, like now you're doing 10 pounds. Next week, you need to be doing 20 pounds, or you need to keep increasing the reps and increasing the strength. And this is like super simple. I mean, we know how to do it, but you really have to keep to it and have a something that you're working on. I'm just giving you this as a reference for how it should be done. And then your environment. So like I said, since using a device was possibly a risk for falls, it would be good to have someone who can give you some advice on making sure it's the right size or the right choice. You should also know that there's a lot of different options out there, so don't be limited. I don't have my favorite one up here right now, but it's like a tripod walker that has a shock absorbing tire that you can let you go on trails with it, but it's really expensive, so that's why I didn't put it on, because I always think it's like not quite reliable. But there was a recent article in the Washington Post that I thought was super interesting about whether or not you want to use hiking poles, and the benefits were better balance for sure, but people also find that they have less muscle soreness. So if just walking around in your everyday life is really like an exercise, maybe that's a good way at the end of the day to not have tired legs. And interestingly, they do actually, though, increase your heart rate in your upper body workout. So you may actually find using hiking sticks makes you more tired, but you could consider it as a way of getting that exercise in little bursts throughout the day, because you're actually using your arms. To use your arms to move is actually more fatiguing than using your legs. So that they're smaller muscles. So that's just one other thought. I'm just kind of giving you that out there because I hear a lot of people in clinic kind of are like, I don't want to use one because of how it looks. But if you think of other, considerations for why it might be beneficial, maybe that's a motivation. And then, you don't want to get in the low chair that you can't get out of just for safety reasons. You want to make sure that, you remove throw rugs from the bathroom and clear power cords and use those lights. There's lots of grab bars, and, use a railing when you can on your stairs or input it. I think from a caregiver perspective, as well as from a person who has a disability, you want to be able to make it easy to get up when you have fallen. And there's a lot of things out there. Someone in clinic taught me about the razor lift, which is sort of more portable and easy to use anywhere as an option. But there are transfer devices as well to make it safer to help with mobility. And then I think you can use strategies. So maybe you need to take your time. Maybe you need to simplify your tasks, like just do one thing at a time, try and walk and talk. When you stand up, maybe it's good to just make sure that you're stable before you take that next step. Maybe it's just like the regular ground, it becomes sort of like stepping onto ice. You test it first, make sure you're stable before you take off and go. And then multitasking, as I said, don't walk and talk. And I think harder sometimes is, to give yourself permission to let someone help you out rather than struggling to do something that might put you at risk. And then having a fall safety plan. So there's all sorts of devices out there now that can detect when you fall and actually, ask you if you need help and easily, allow you to say, I fell, I'm okay, but I need you to, I need some emergency help. And then also a plan for how to get up from the floor. So one of our Hopkins OTs put together just a stepwise way of one possible way to get up from the floor, but it might be something that if you haven't in a long time gotten on the floor on purpose, it might not be a bad thing to test every day to see, if I get on the floor, can I get back up? Because when it happens by accident, it's a lot harder to then have to figure out how you're going to do it. So I'll just leave you with my summary, which I think is education and considering what you might want to change about yourself or your strategy or your environment in order to keep you safer. And I really appreciate everything that everyone has taught me, and I hope you'll all stay safe without falls. Thanks.
Thank you, Jen. All right, we'll start with questions over in the back.
We have one online question. The question is, can you elaborate on the importance of the ankles in balance? And also, what exercises are good for a pronator?
Okay, sure. So I think when you don't, when you have an intact nervous system, like typically when you're standing still and you're trying to stand still, you actually have a little bit of sway. And so it is your ankle muscles that are kind of, they're kicking in order to slightly adjust you forward and back or side to side. And that comes from having your proprioception tell you that you've moved a little bit to the front or to the back or from one side to the other. When you don't have intact proprioception or you have weakness, you can actually learn to do that same thing from like at your hip. But what happens is you have to move more before you realize that you've shifted your weight, and so then the recovery can be harder because it's like a bigger movement. You know, you kind of see people kind of overcorrect. That's sort of what happens. Exercises for a pronator. So actually, I mean, it all depends, as we feel like I said, but just doing toe raises or heel raises is like a really good thing to strengthen your, usually it's your gastroc or your heel cord that contributes to help you be less of a pronator. So that's a.
Any other questions? Ken and then Chris.
I just wanted to let you know, you were saying about how you've touched the wall, you know, to pretty much keep your balance. We call that wall surfing, and we take it very seriously. So yeah, so wall surfing. If anyone ever tells you that,
I'll
that's
have
what
to
we're talking
update my
about.
language terminology. Thank you. Wall surfing.
Thanks. I really appreciate the talk. You know, I guess probably all falls are not the same. It's the falls where you get injured that are the ones we really want to avoid. Are there strategies or are there any studies about whether you can either practice falling or plan how to fall so that even if you fall the same number of times, you're less likely to be injured? I know at least for myself, like even if I'm carrying something, I tell myself, yep, I'm going to let my laptop go. If I fall, I'm not going to try to save it. I'm just going to drop it and try to protect myself. So that's about all I can think of. But are there any strategies, or is there any evidence that that might be effective?
That's a great question about whether or not there are strategies for teaching yourself how to fall. And I did see that there are a couple of programs out there about teaching yourself to fall. It reminds me of learning to ice skate, and they teach you to fall on your butt so you don't get your fingers run over with ice skating blades. But I guess I think that that's more of a strategy, like you're saying, that you like learn to pay less attention to what you're carrying and more attention to, how you're moving. I don't know about the results about whether or not that's effective or not, that you can teach yourself to fall. I do know you do not want to land on your head. So, whatever you can do to avoid that is a good strategy. I'm happy to follow up and learn if there's something more about that and get back to you, but I don't know. So, all right.
Any last questions? Okay, excellent.
So going back to the balance parameters that you were talking about, the 4 times a week for 6 weeks, 20 minutes, could you talk a little bit about what results you saw with that and possibly outcome measures?
Sure. So they're pretty common outcome measures. It was in a different, population, so slightly different. But I like timed up and go and walking speed. Those are good measures to use to look at whether or not your balance is improving. Those are good things. We also looked at sway, standing balance, but any standing balance measure. So it's a good point to use something like see if you're getting better. How long can you stand on one foot for, or how well can you go do this timed up and go test? Probably everyone's done it by now, but you get up from a chair, you walk 3 meters, turn around, come back and sit down, and how long does that take you? to be honest, like while everyone uses that for literature, like there's no real like cutoff point. Like for if it takes me 15 seconds, I'm definitely going to fall. So it's got its usefulness is limited. The exercises were patient specific, so they were based on seeing what people could do and then coming up with something that was. And they worked mostly on being stable, and then once you were stable, adding other components, so turning your head, closing your eyes, reaching in different directions and things like that, both in sitting and standing, and so progressing it that way. Yeah. Okay. Thanks.
Thank you so much, Jen. Round of applause.